All right. Well, good morning, everyone. Thank you so much for joining us. We will go ahead and get started. And we're so glad you could join us here for our webinar this morning on Teen Talk for Youth in Alternative Settings, which is to introduce to you all California's new online sexual education course for foster youth. This is developed with partners from the Reproductive Health Equity Project for Foster Youth. To participate today, we will have a question and answer session at the end, and we will be sharing the recording, slides, and all materials with everyone today. So please put your questions in the chat throughout by clicking on that Q&A panel, and then also letting us know. It's a little bit hard to monitor questions in the chat, so just make sure that you're putting the Q&A in there, and anything we don't get to today, we will also follow up by email with all of the materials. So what are we going to cover today? We are going to introduce our presenters in a moment. We're going to share with you sort of the legal history behind comprehensive sexual health education, as well as ensuring that foster youth receive that at least once in middle school and high school. We're then going to introduce to you this new curriculum that was created for foster youth in California. We're going to have one presenter who's going to talk about their perspective. They've taken the course, they are former foster youth, and they're going to tell us about that experience and how positive that was. We're also going to have presenters talking about tips for how to have this conversation with young people that you're supporting. How do you talk about comprehensive sexual health education, signing up for the class, registering for that class, the how-tos, and what to expect from the course. Then we'll answer questions at the end. But we're so glad that all of you could join because this is such an important topic for us. And we've got a lot of strong presenters. So today you will hear from myself, Anna Johnson, with John Burden Advocates for Youth. We are part of this Reproductive Health Equity Project. And we're joined by Rebekah Goodman from National Center for Youth Law. Kay Howe Gunderson from Health Connected. Kat is a Youth Advisory Board member with RHEP. Zoe, Francesca, and Ceci are from Planned Parenthood of Pasadena and San Gabriel Valley. And so all of our presenters today are going to walk you through everything you need to know about the law, the curriculum, working with youth, and what to expect from the course. So as part of Reproductive Health Equity Project, this is a project that is for foster youth. It's a partnership of adult advocates and foster youth working together to promote healthy sexual development. And really our goals are to improve access to sexual and reproductive health care and services and make sure that youth get this comprehensive sexual health education and are supported as they develop and grow with their health. We really want to normalize the systems around young people and promote their healthy development. And we all work together to change this by uplifting youth voices, supporting policy change, creating connections between systems. Today, you'll hear about how the school and education and district work is connected with health educators and the child welfare system. So a partnership across these systems. And we're trying to take an innovative approach right now during the pandemic, especially we'll talk later about how that has impacted young people's access to comprehensive sexual health education. And RHEP actually also has a youth advisory board, caregiver advisory board, and they're joined by many public and nonprofit agencies on a leadership team. So you can find out more about all of the work that we're doing on the website here. So to launch into our content for today, we'll have our first speaker. Rebekah is here today from the National Center for Youth Law and is a senior director. And Rebekah focuses on health equity and access, has a degree from Harvard, a JD from here in California at UCLA School of Law, and an MPA from Harvard, and has won a number of kind of awards with the American Bar Association's Young Lawyer Child Advocate of the Year, as well as getting national chapter recognition from the Society for Adolescent Health and Medicine. So welcome, Rebekah, and thank you so much for being here today with us.
Thank you, Anna, and good morning, everyone. So we thought to help understand the curriculum that we're sharing today, we thought it would be helpful to share the context in which it arose and the need it's meant to serve. And that requires going back and talking a little bit about some groundbreaking laws that we have here in California. So next slide, please. Thank you. So the first important context is to understand the California Healthy Youth Act, which was passed in 2016. It's also known as CHYA, C-H-Y-A. CHYA is groundbreaking legislation, frankly, that requires all public schools and charter schools in California to provide comprehensive sexual health education in middle school and in high school. The California Healthy Youth Act had several purposes. Some of the goals that it was intended to address were to provide students with the knowledge and skills necessary to protect their sexual and reproductive health, but also to provide students with the knowledge and skills they need to develop healthy attitudes concerning adolescent growth and development, body image, gender, sexual orientation, relationships, marriage, family, and to promote understanding of sexuality as a normal part of human development. Its goal is to ensure students receive integrated, comprehensive, accurate, and unbiased sexual health education and provide educators with clear tools and guidance on how to accomplish that. And really, in the end, all of that is to help provide students with the knowledge and skills necessary to have healthy, positive, and safe relationships. It does this by not only requiring schools to deliver education, but it does require some specific content be addressed in that curriculum. And there are some certain training requirements, as well as standards for teachers. So next slide, please. So as I said, it includes some training and content requirements. I won't read out all of these. We do have more information about CHYA on the Foster Repro Health website, but I just want to highlight a few of these. In order to be considered a compliant education, the program must be age appropriate. So as we said, there's middle school and high school, and it needs to be appropriate for those ages. It also needs to be appropriate for all races, genders, sexual orientations, and ethnic and cultural backgrounds, as well as for students with disabilities and English language learners. It is required to teach about gender, gender expression, gender identity, healthy relationships, decision-making, and even intimate partner violence, sexual assault, trafficking, among many other topics. The framing is supposed to encourage communication with parents or the other supportive adults that a young person might have in their life, and affirmatively recognize different sexual orientations. So CHYA has been in place since 2016, and the hope is that we've made sexual health education available to all youth across the state. However, next slide, please. This is data from a forthcoming report that our RHEP team is producing. It's data from a survey, an interview survey with over 120 youth in foster care this last summer, youth ages 12 to 20. And you'll see here that of all of those young people aged 12 to 20, only about half received any kind of sexual health information or education in school. And in fact, the most common source of information for them was their friends or peers, which is not necessarily reliable. We don't know what is being shared. Often we think of this as something for a family to discuss, but as this data highlights, that isn't necessarily happening for young people in foster care. And that's one reason why this school option, the CHYA option, was all the more important to make this available for young folks. So why aren't young people in foster care able to access sexual health education in school? If you could go to the next slide, please. It's really probably not too surprising. Next slide, please. You know, I'm sure everyone can imagine some of the examples. Here's just a few. As we know, there's unfortunately quite a few placement changes. It's not uncommon to have multiple placement changes even in 1 year for a young person in foster care, which also leads to school instability. In fact, 34% of youth in care will experience 5 or more school changes. And that can make it very easy to miss the semester or the series of classes in biology in which sexual health education is addressed. We also have a number of young people in foster care who don't attend a public school or a charter school, and so they won't have access to a CHIA curriculum. And then, of course, we may have foster parents or biological parents who have waived children out of school health. But unfortunately, as we've seen, that means that they may not be getting information from any source. So this is what in part spurred another law. If you could go to the next slide, please. So in 2017, California passed the California Foster Youth Sexual Health Education Act, SB 89. And one of the goals of SB 89 was to ensure youth in foster care can receive the same CHIA compliant education as every other California foster youth, once in middle school and once in high school. Next slide, please. And so how does it work? Basically, starting at age 10, the caseworker for that child, maybe a social worker or probation officer, is supposed to check in annually with the youth and with their school to verify whether they've received sex ed or whether they need sexual health information. If the youth haven't received that instruction in school by the end of middle or high school, the worker must ensure that the youth receives a CHIA compliant education in the community. Next slide, please. So sort of this portrays that same information in a different way. This is after the passage of this new act. What's supposed to happen is the caseworker is annually checking in, and at the end of 8th grade, so we have those sort of 2 key points, 8th grade and 12th grade, if the caseworker has confirmed that the youth received comprehensive sex ed in school, you check a box, good to go. If they haven't, the worker is supposed to find an equivalent program in the community and enroll and ensure that the young person is connected. But as you'll see, we put sort of a red dotted line there because sometimes it's easier said than done. Child welfare agencies around the state have been facing some challenges making that connection for a number of reasons. Next slide, please. So what have they been facing? This is just a few examples. Particularly in the last few years with COVID, there are some districts that have lacked the resources or the ability to provide comprehensive sexual health education. And so it's been difficult to meet that requirement in school. It's been sort of a low priority, competing with other educational needs, understandably. And so when then workers have needed to look for an alternative program in the community, it's actually been more difficult to find than perhaps we originally envisioned. Or they might find a program, but they have to figure out the logistics of getting the young person enrolled, getting them transportation to get to the class, figuring out the timing with competing demands on the schedules of both caregivers and caseworkers and the young people. And all of this has meant that it's been much harder to make that connection for young people who've been missing the curriculum in school. Next slide, please. And so this is where RHEP saw a need, the Reproductive Health Equity Project saw a need both to make education more available and accessible, and considering the time constraints on the caseworkers and the caregivers and the young people and the education system, to make it really easy to enroll youth and get them connected. So that's what sort of drove the curriculum you're going to hear about now, and that's what I'm going to pass it to my colleagues to share. Thank you.
Thank you, Rebekah, for that overview. And thank you. Next, we will hear from Kehao Gunderson, who is the California RHEP Specialist and Senior Trainer for Health Connected. Kehao started at Stanford University at age 16. Classes like adolescent sexuality and adolescent mental health weren't just fun and exciting, but they also attended topics covering things that were personally relevant. And from that time, it sort of inspired a whole career in sexual health education. And Keha is going to share today more about some of that effort for RHEP and with this new curriculum. So we'll go ahead and pass it over. Thank you so much for joining us today.
Yeah, so happy to be here. Thanks, Anna. So like Rebekah was alluding to, there were some barriers, especially with our youth in foster care receiving our CHIA compliant sex ed. So at Health Connected, one of our main projects through RHEP is creating a curriculum that is really geared towards youth in the foster care system. And we call our new curriculum Teen Talk for Youth in Alternative Settings. You may hear us refer to it as Teen Talk YAS moving forward, but we're really excited about this new curriculum. So I just wanted to go through an overview of what this curriculum is and a little bit more about us at Health Connected. So Health Connected, we've been around in the Bay Area for about 25 years, and we are one of the leading providers of comprehensive sex ed. We really like to take a community-wide approach when it comes to sex ed, and so we do have a variety of services. One of our main services is providing direct instruction. So there's many school districts, especially in the Bay Area, that our team of about 10 to 12 educators are going into classrooms and providing that instruction. So as of today, in the past 20 years, we've been able to provide instruction to about 500,000 students. One of my other jobs at Health Connected is I'm one of our lead trainers. And so we do like to do, as well as parent talks, we do a lot of teacher trainings as well. So if our team can't get to that school district because we are based in the Bay Area, we're doing a lot of teacher and provider training as well. So we've been able to train over 5,000 teachers, and one of our curricula, at least one of our curricula, is being used in over 130 districts in California. So on our screen here, we can see the 5 curricula that we already have available. At Health Connected, we create our own curricula and we also self-publish, which is awesome because we get a lot of feedback from providers, teachers, students, youth, and we can make adaptations to our curricula to better suit the youth that we are servicing. So the 5 that we have so far, or had so far, now that we have a new one, we have a puberty talk curriculum that's for 5th or 6th graders, a middle school curriculum for 7th or 8th, a high school curriculum that we usually provide in 9th or 10th grade. And when I first started at Health Connected, those were the only 3 curricula we have. And we realized there were different groups of youth that weren't being taught any of this CHIA compliant sex ed. So we've created a refresher program for 11th or 12th grade. And I also was a lead writer on our Teen Talk Adapted for All Abilities curriculum, which is for youth in special education. So we're really excited, like I keep mentioning, about our new curriculum that we've developed, which is our Teen Talk YAS. So on our next slide, we have an overview of how YAS is a little bit different than our previous curriculum and everything it encompasses. And I'll talk a little bit more about each of these points on our next slides too. But it is created with a healing-centered framework. We have done a lot of collaboration with current and former youth in foster care. It was originally developed to be an in-person curriculum, but through the past couple years and just through feedback from youth and providers, we have adapted it to be done online now. So it is a live training. We like to do the YAS sessions over Zoom. I know our Planned Parenthood educators will talk more about how that has been going. We've included resources for the youth going through the program as well. I'll talk a little bit about our Google site and the YAS booklet that we have available. Like Rebekah mentioned, this is a CHIA compliant curriculum. So to be CHIA compliant, we've divided it up into 11 sessions, typically meeting 1 hour for each of those sessions. And after completion of the program, we do provide documentation of that completion for that youth and their social worker to be documented. So on our next slide, here's just a quick overview of what those sessions are. So it is broken up into 11 different sessions. So kind of the minimum amount of time is about 10 to 11 hours to cover all of that content. So I'm not going to read through our session topics, but I'll let you do so. But going through all 11 sessions would ensure that that youth has gotten CHIA compliant sex ed. On our next slide, I just wanted to show you what our booklet looks like. So for a lot of our youth, because they are online, they may be learning in different areas of the district or of the state. And so we've created a Teen Talk YAS booklet that we mail out to the youth in our programs. And this is about a 20-page resource guide. So if they had more questions or they needed more information, the YAS booklet has a lot of great information for them, along with fillable activities. There's some room for doodling, room to take notes. We've also included a lot of communication practice questions in case they want to open up these conversations to other trusted adults in their lives. Another thing that we have on our next slide is a Google site. So each session or each pilot that we're doing with youth, we do create a Google site that, again, gives them all these resources or any information that they may need in the future. We're trying to get that information to them in different ways. So through a Google site, through a booklet, and through our sessions. In our overview slide, I mentioned that we created Teen Talk YAS with a healing-centered focus. We do have a lot of trauma-informed best practices used throughout our sessions, but we're really trying to shift even more so to a framework of healing that really honors the wisdom that youth bring to conversations about sexual and reproductive health. So we have collaborated with Dr. Sean Ginwright, who created a karma model of healing-centered engagement. And so on our next slide, we break down what this karma model is. And these are some themes that we see throughout all of our sessions. So karma stands for culture, agency, relationships, creating meaning and making, and honoring youth aspirations and wisdom. So it's a little bit different of a framework that we have in YAS compared to our other curriculum. So we're really celebrating those youth that are coming to our sessions, celebrating their culture, reminding them they do have agency, and talking through relationships and aspirations with them as well. So before we have our next speaker, we have done, like I mentioned, a lot of collaboration with former foster youth in our youth advisory board. So on our slide here, we have some quotes from our YAB members that were able to go and help us through our prototypes or were able to attend one of our pilots. So some really great quotes coming out here. I know our next speaker is a YAB member, the amazing Kat. So she's going to speak more to her experience more, but I'll go ahead and just let you read these really wonderful quotes that we got after our prototype.
Thank you much, Kay Howe. Before you jump off, we did have one question that I thought maybe we could answer right away, which was,
Sure.
Can you talk about this curriculum from the Soji lens? So I know you mentioned like the trauma-informed approach, the karma model, but can you also talk about Soji for a second?
Sure, and I love that this acronym's being used because we like to use it too. So Soji stands for sexual orientation, gender identity, and expression. And so I believe it is session 3 that we spend a lot of time really talking about identities. So not just sexual and gender identities, but other identities our youth may hold. But we have probably like a 30 to 40 minute presentation talking about some of the most common Soji identities that we have. But throughout the entire curriculum, it is inclusive. So as we're talking through relationships, we'll have scenarios with heterosexual couples and gay couples and lesbian couples. So we keep an inclusive lens over everything, but we actually do have one day that we kind of specifically spend more time on Soji topics. So I hope that helps.
It does, thank you. And we'll take more questions at the end, so keep putting your questions into the chat. So next we will hear from Kat, who is a RHEP Youth Advisory Board member and also a burgeoning podcast star of Lessons Learned in Care, a podcast coming soon. Kat has taken the Teen Talk YAS course and would like to share with you all their overall review and some advice for how you can reach out to your students or youth on your caseload or young people you're working with to talk about this. And just to young people who may not have received comprehensive sexual health education. So good morning, Kat, and welcome.
Hi, Anna. Thank you so much. And thank you, everybody, for having me. I'm happy to be here. I'm Kat. I'm 25. I'm a graduating senior from Sacramento State University. And I'm still living in the small town that I pretty much grew up in, which is just outside of Sacramento. This curriculum was really great for me because I never actually received any kind of formal sex education. And even though that's not a direct cause of me being a foster kid, it's super related for sure. I was a super anxious and still kind of am, very anxious, very squeamish child, super ashamed of my body and everything that it did. And to paint you a picture, I'm going to tell you all what was the most embarrassing moment of my life, pretty much up until like the last couple of years when I joined RHEP and we started actually sharing and exchanging stories. So you know the signs that are posted in the women's bathrooms that all say like, please don't flush your lady items. I'd never noticed them apparently before my first period, and I had flushed like a whole box of them at my house before we started having plumbing issues. And that's pretty much how my family found out that I'd become a woman. They were not happy about it. And I don't think they thought about this, but I wasn't too happy about it either. Yeah, and to add to all of that, my brother told all of my friends, and then they started lecturing me too. I don't think anybody realized that I wouldn't have done that if I had known you're not supposed to do that. I just like remember laying in this field of dry grass and just like waiting and a little bit just willing for my heart to stop because I was pretty sure if you could die of embarrassment, that's exactly what I was going to do. But I lived and I'm okay. And so the next year anyway, I was in 8th grade. And I was super not excited for our teacher to have the sex talk with me and the entire 8th grade. And we all had to get our parents to sign these little permission slips and check off if they wanted us to either take the class or basically have free play all day. So my grandma didn't really care what I did. So for that day, I got to be like the coolest kid in 8th grade. Everybody else had to do that. And I could just draw and color and read or whatever. But that, of course, came at a cost, which I didn't find out till later. I'd also just really like to highlight that I was incentivized not to take that class. And I guess I was supposed to get that talk again in high school, but I went to a continuation high school, which by all accounts, it totally saved my life. However, they've been shut down and we were some very challenging children and we definitely came from alternative settings and that's why we were there. Our high school had its own daycare for the babies of the parenting children there. We used to joke like, don't drink the Chan water because it'll get you pregnant. So I can definitely understand why there's no teacher at that school that would be willing to tell us how sex worked. I think we kind of had it figured out. My education was pretty much limited to this one time. One of my older foster sisters had like drawn out the female reproductive organs and it kind of looked like a moose. So that's pretty much what I thought Teen Talk was going to be about, but I was really impressed because there's like a lot more to it, We talked about that stuff, but we also talked about relationship dynamics and dating safety and how porn is not actually what sex is like. And I think one of my favorite things is that for that super easily embarrassed child me, I could be anonymous online. So I'm getting all of this information and nobody's watching me do it. And when I have a specific question, I can ask that safely. It was more invitation to learn, not confrontation. And that's obviously great for any kid, but it's especially crucial if you're a foster kid, because I think what we consider developmentally appropriate shifts, and a lot of times dramatically, if you're a kid that's had what I like to call lots of growth opportunities. And to complicate things, when you mature, you don't necessarily mature all at once. Maybe you're more mature in some ways than others. And basically, we just really need a curriculum that's designed to meet us where we're at. And this does a really good job of that. I also feel really compelled to just note that 60% of sex trafficking victims are foster youth, and it's absolutely not a coincidence. And I think it has everything to do with what we're taught or not taught. Like I was saying, you probably maybe already know this, but like 60% of our sex trafficking victims are foster youth, and it's not a coincidence, and it absolutely is related to this curriculum and what we're missing out on and what we're taught or what we don't find out about relationships because of the kind of circumstances that we have and what's modeled and stuff. And I don't know if there is any better tool than, or even any other tool than to educating kids about self-love, coping strategies, dating safety. I never got any of that. Another thing that I got out of this course, a little bit lighter, is, I'm 25 now, and I had no idea that you don't actually need parent permission to get birth control. So I don't need it now, but I learned that. And my 16-year-old coworker, we'll call her Sarah, she was telling me how she really wanted this copper IUD, and she had done all this research to find out what was right for her, but her mom wouldn't let her get it because she was worried that if Sarah was protected, then she would start having sex. But, you guys have probably already guessed what Sarah's mom didn't guess, which is that Sarah was already having sex, but now she gets to do it with the protection that she wants for herself. And I think that's really cool. I would say if this opportunity were presented improperly, the squeamish and shameful 13-year-old me would have absolutely found any way to squirm out of it. I can definitely envision my grandma waving her finger and warning me, like, there's so much you don't know, or, someday you'll wish you had. And she wouldn't be wrong, but she also wouldn't be very convincing. First of all, because I thought I knew everything. I was a teenager, right? But secondly, because even if I had wanted to talk about it, I wouldn't have wanted to admit that. So I think it would be useful to frame it as not like you're so young and you're lacking knowledge, but like you're growing up, and this is a part of that challenging process. My last piece of advice is create an incentive and just leverage it if at all possible. In high school, we had these classes that were basically like AA for kids, alternative settings, right? So if you chose to go to that class, you could get credit for going to history or science or whatever class you didn't want to go to. So notice how that's the exact opposite of my 8th grade experience, where we were incentivized not to go. Everybody wanted to go to the AA class. So basically, I just wanted to say that I'm so honored just to be able to be a part of this process and to have benefited from it. And now I'm just so excited that I got to share my experience with it. And at the end of it, I just felt like my heart is so warmed just to even know that this program exists and know that people are recognizing this problem and working on it. And as much as I wish I had it as a kid, I still help me as an adult, and I can help other people with what I'm learning. And I just know that this is going to change lives. And yeah, thank you guys for all coming back and coming to my talk.
Thank you so much, Kat. As you're seeing in the chat, everyone thinks you're amazing, and I'm sure they'll be tuning into your podcast when that starts. So thanks for sharing your experience. It's so common. As a former educator, I myself had experienced a lot of young people with they didn't have all the information they need. So to our educators out there and to our young people out there, we really appreciate you connecting and helping spread the word. So our next slide, and just can I check, can people see the slide here? Is it looking okay? All right, great. So we have Ceci Martinez, who's the manager of community education at Planned Parenthood, Pasadena and San Gabriel Valley, who will be sharing with us a little bit more about how to connect with young people and sort of the ins and outs. So thank you so much, Ceci.
Thank you, Anna. So like she mentioned, I will be covering how to bring up this education opportunity with our YAS curriculum, and as well on how to answer questions that have to do with sexuality if you are identified as a trusted adult, or if youth come to you after starting this YAS curriculum. Next slide, please. So first and foremost, it's very important to recognize your own thoughts, feelings, and biases about sexuality. A lot of us did not receive sex education, and we might have grown up in cultures where talking about sexuality is taboo. And it's important to know that sexuality is a very natural part of life that not only encompasses sex, but it encompasses puberty, relationships, menopause, identity, etc. And it is something that we have for our entire lives. So it's definitely very important to recognize how you feel about sexuality so you can have these conversations with the people and the youth in your life. It's definitely very important to approach this conversation holistically. Most youth may not care if this is something that they need to complete because of what is required in California. Youth want to know that the adults in their life care about their health and their well-being. So a very natural way to bring up this conversation could be if there's a song on about sex, or if they're talking about a show that they really like. So for example, Euphoria is a very popular show right now, and there's definitely a lot of violence and sex in that show. So we don't see a lot of conversations about consent or safe sex in the media. So situations like these can make the conversation flow a little more naturally. So if there's a song on in the car, or if they're talking about their favorite show, we can ask something like, hey, what do you like? What do you think about that lyric in that song? Or what do you think that means? Do you think that that is accurate in real life? These are very natural ways to start up that conversation. And as that conversation is flowing, you can share resources available for youth. There are many books, websites, and even social media creators that share a lot of useful education. And this is a great opportunity to bring up YAS. So for example, hey, I came across this opportunity for youth and it sounds pretty interesting. It talks about X, Y, and Z, and share some topics that might sound interesting to them or that align with that conversation that is happening. And this is where we can gauge their interest. So we don't want to force youth to do something that they don't want to do, or maybe they're not ready to do. If you're signing up youth, you want to make sure that they are aware of what you're signing up for them to do and that they want to do it as well. In the past, there were some youth who were signed up for the pilots without their knowledge, and there wasn't a conversation around it. So of course, these youth didn't show up. And very important to be available to them throughout and even after the pilot. If they're not interested in the pilot, that's okay. We have many pilots from now until July. And you can still be a trusted adult, even if this pilot is not completed, or if they come to you after checking out the communication practices in the YAS booklet that Kay brought up. Next slide, please. So here are some tips on how to answer questions regarding sexuality. Again, we're not all experts. We may not feel comfortable having these conversations because you may have not had these conversations in your life. So if someone comes to you with a question, it's definitely okay to pause if you feel nervous. And it's very important to make sure that there's no negative non-verbal communication. Our face expression can communicate a lot. So we want to make that we want to make sure that our poker face is on point so that we're not communicating anything negative. So a classic, way to take some time is the, that's a good question, right? And just nod and, take some time for yourself so you can have time to process on your next steps. And positively affirming all questions is very important because this will continually establish trust with the person who's asking the question. Remember that they came to you because they have trust in you. So let's make sure to keep that trust. So an example could be, I appreciate you coming to me with that question. It is an important question. I actually have the same question when I was your age. And make sure you understand the question. This will help you answer the question in a clear and concise manner without giving unnecessary information. So for example, let me see if I understand what you're asking about and repeat the question. And sometimes youth may already have this information, so ask youth if they know the answer to the question. This can help determine what they already know, and it can prevent you from overindulging too much information. So, for example, if someone asks, what is sex? A response could be, that is a good question. What do you think sex means? And answer the question simply, honestly, and help describe the community's range of beliefs. It is important to keep in mind that sometimes our personal values may not align with youth's developing values. And although we may want them to follow similar values, we must validate their own unique worldviews. So in my past experiences with professional development trainings, this is where staff are a little bit hesitant because they are nervous about answering these questions that may not align with the values of the youth's family. This is why it's very important to mention that there's a range of beliefs. So for example, a lot of youth ask about masturbation. So the way that someone can answer that is, sometimes people think, there's a lot of people who think that masturbation is not okay. There's a lot of people who think that it is okay and that it's actually healthy to get to know your body as long as it's done in a private and safe space. So that is an example of how we can offer a range of beliefs. And then we have ask whether youth understand the response. We want to make sure that the answer is kept simple. Youth want to know facts, and sometimes because adults get nervous, they may give too many details. And if they do not understand the response, you can try reducing the information to small parts or using different words, or ask what was not understood to make sure that you are sharing the correct information. And of course, leaving the communication doors open reminds them that they can come back to you for any other questions or situations that may come up. Next slide, please. We do have some phrases that leave the communication doors open, and this is an example of a list of phrases that do that. I will not read through this because I will be sharing a handout that has this information that I just covered. Next slide, please. And this is an example of phrases that leave the communication doors closed. So again, this will be shared in the chat so that you can download this handout and look over these tips. And we are in the San Gabriel Valley area. We actually do provide trainings for professional development and also for parent guardian workshops to have these conversations about sexuality with youth. So if you're in the San Gabriel Valley area, you can definitely reach out to us. I will drop our email in a bit. And if you are outside of the San Gabriel Valley area, you can always look up your local Planned Parenthood to request training. And now I will pass it back to Anna.
Thank you, Ceci. And we will hand it over to Francesca, who is an education project specialist with Planned Parenthood of Pasadena and San Gabriel Valley. This is, a lot of people are asking questions in the chat here about how do we actually sign someone up and register, and we will go through that in a second. And there's also questions here, if you can talk about it, Francesca, about trainings available in Spanish.
Okay, great. Thank you, Anna. So I'm going to go walk everyone through a little bit of the nuts and bolts of registering. So can we see the next slide? Great. So many of you might have already got an email with this flyer, or might receive a flyer like this after attending this webinar. And so I'll kind of take you through the information that's on it. I saw some questions about eligibility. Someone already answered part of that in the chat. Unfortunately, this flyer is a little bit out of date, but that's okay. the series are eligible, so youth who are eligible in the series are youth who are in foster care. We've expanded that to anywhere in California, youth who are ages 14 to 17, or who are still in high school. It's just like additionally, we need to make sure that youth have access to Zoom, and headphones would be preferable for privacy issues. So getting to how you register. So there's a couple different ways. If you don't have a young person that you would like to enroll at this moment, but want to stay connected and want to continue to get information on upcoming series, you can fill out the interest form, which we'll add to the chat in just a second. And if you are interested in enrolling in a particular series, I'll tell you how to do that. So if we could go to the next slide. So if you visit the Foster Repro Health website, again, we can put that information in the chat. You'll see this website, and there'll be a number of different series dates that you can choose from. Once you pick a series that you'd like to enroll somebody in, you'll see this page. We can go on to the next slide. So you'll be taken to a Google form, pretty standard. All the dates and details you'll see at the top. The most important piece of this form, you'll see here on the right-hand side, is the youth email and the youth phone number. So for us, it's very important that we get this information because we want to be able to connect directly to the youth. Once we have their email and their phone number, we can send them the webinar link. We can send out information like the Google site that we talked about earlier, and recap information just to make sure that youth have access to the info in writing once they leave the webinar. If we don't get this information, Zoe, one of our educators, who's going to talk a little bit after me, she'll be reaching out to obtain this information from you if you're the one enrolling a young person. If for whatever reason a young person doesn't have an email or a phone number, then we'll need to have the contact information of an adult who can support the youth in logging into the series for each session. So again, it's really important that we can connect directly to the youth, but if not, we will need somebody who can support them in logging in. Next. And so lastly, if you have questions that don't get answered in this webinar or they come up for you later, the Foster Repro Health website also has a space where you can ask for support, and you can fill out this information here. Next. And I think that's it for me. So I'm going to pass it over to Zoe.
Thank you so much, Francesca. And we'll have more from Francesca during Q&A. But next we have Zoe King, who's a health educator with Planned Parenthood as well. And they're going to talk to us a little bit about just kind of the final part of our presentation today before Q&A about what to expect during the series. Thank you, Zoe.
Thank you, Anna. I'm just going to kind of piggyback off what my colleagues have shared. So like Francesca and Ceci were both mentioning, it's very important to register youth under their own contact information. The reason for this is because I will typically email them like the Zoom information, and I send out weekly, depending on the duration of a series. I'll send out reminder emails, I'll send out reminder texts, and also the recap emails. So the recap emails are basically like a review of what we talked about on a given day. So for example, if the duration of a series is 4 times a week, they'll get a recap email 4 times a week. But if it's only twice a week, they may get one on one day and then one on the next week, right? Just to go into like the confidentiality, so it is webinar style, so it's just like this where you all can see me, but I am not able to see any of you. Just like Francesca mentioned, we do encourage you to wear headphones just because, you know, we are talking about a lot of different sexual topics and they may not feel comfortable like having it loud and audible because I'm very open and I answer any questions that you ask me. But we do encourage also a private space. So again, they can feel more comfortable if they are unable to use headphones at that given time. The only caveat to the confidentiality is that I do inform the youth that I am a mandated reporter. So if I suspect that they are being hurt by someone, they may hurt themselves or may hurt someone else, I do kind of just throw that out there like, hey, like if I suspect this at any point during the series, if anything you share with me suggests that, I am going to have to contact CPS or local law enforcement um, to get you more support, right? I see a question coming in. Is the webinar only available in English? Unfortunately, I am not a bilingual speaker, but my manager does speak Spanish. So perhaps if someone was interested in a Spanish style, that could be arranged. But as of right now, it is only me presenting and I do not speak Spanish. Next slide, please. So again, just to piggyback off what others have shared, it's important that you have reliable Wi-Fi just because it is over Zoom. And as you see, like anything can happen when it is over like an internet type of setting instead of in person. They have the Google site that which they can access all throughout the series and even afterwards. And on the Google site, you'll just be able to see all the like resources available for each topic. There's hotline numbers, there's websites available, there's instructions on how to get services, all types of good information on the Google site. And there's also follow-up activities and links, etc. And like Kayhal mentioned, there is a booklet. So on the Google site, there is a virtual version of that booklet. So if someone is unable to get a physical copy of the booklet mailed to them, there is a PDF version of the booklet available. And then the last thing I want to talk about are the incentives. So currently the incentives stand as $50 for attending 8 sessions. Attendance is taken daily. So every time we have a new session, attendance is taken for each session. So if a person attends 8 sessions, they automatically receive $50 for that session, for those sessions, right? But if they attend all 11 sessions, then they get a $25 bonus. And like Ceci mentioned earlier, it's very important that youth like know they're being enrolled for this pilot or for a series. It does show that more engagement and participation is there when they are aware that they have been enrolled in a series. So whether you're a caregiver, a social worker, or even if you just allow the youth to register themselves because that is an option, that's very important that they are just aware. I have a current series going on right now, and there's one youth in particular who's very much open line of communication with me. They always let me know like, hey, I'm going to be late today, or I missed this one, so can you send me the recap email to make sure I get the information? So you do appreciate this information, but we do notice that like if they're not aware, they may just automatically be on the defense. So it's just very important to have an open line of communication with them. And I make myself pretty available. Like, of course, I don't respond to text outside of like work hours, you know, to maintain a certain level of professionalism. But anytime you text me a question or let me know something, I am very quick to respond. I try to check in on them if they're like, I notice they are not attending or they haven't attended a certain amount of sessions. I offer an alternative so that they're able to get their incentives, right? Because of course I want them to get the information, but I know the incentives is a large part of them attending. So I do just kind of like throw that out there every once in a while. We actually have a series going on right now, so that one is almost at an end, but there is one that is going to start at the end of February. I believe it starts February 28th. I believe more resources and more information about that will be made available. So if anyone is interested in signing up a young person for that, that will be very good for me. So yeah, I'm going to pass it back to Emma.
Thank you so much to all of our presenters and to everyone asking amazing questions in the chat here. So first, I want to direct a couple of the questions that were asked were, how can we get these resources, or is there a flyer available? Anything that was talked about today, I will include in a follow-up email with the recording of this webinar. And I know, Keha, there were a couple of questions directed to you, I think, about is this curriculum appropriate for youth with developmental disabilities, and how could we get access to some of your other trainings and classes? So would you mind answering that first question?
Yeah, which is a really great question, because as we know, working with youth in foster care, there is a wide range of learning abilities for various reasons. So as of now, our YAS curriculum, youth should have about a 7th or 8th grade reading level to go through all of the sessions, just because we do have some higher level chats. We want to have some of those higher level discussions. But if you are working with youth who may not be at that higher reading level, feel free to email me, and I'm happy to work with you and maybe send you some adapted material from our other curricula, which is Teen Talk, adapted for all abilities. So we have to be flexible a lot of the times as health educators. So feel free to reach out to me if you are interested in adapted material.
Thank you so much. I know it's 10:30, but we did have some tech issues, and we had originally planned for at least 5 minutes of Q&A. So I'm going to stay on and answer Q&A and also send out the video. And if I understand if people do need to log off because the time is complete, but we'll answer a couple more questions for you here. But again, everyone's email is on here. We're all really responsive to your questions. Rebekah, there were a few legal questions asked throughout the presentation. So do we need parental sign off, or what about schools? Are they still able to do what Kat experienced? Like, what is the law now around these waivers on sex ed? And can you just clarify some of the CHIA rules again, as well as for foster youth, what's needed for them legally to be able to sign up for this course?
Yeah, thanks for asking, Anna. So one of the important things that the California Healthy Youth Act did is it sort of flipped on its head the parent requirement. So it may have been when Kat was in school that you actually needed affirmative parent consent to participate, or caregiver consent to participate in sex ed. But what CHIA said is the default is participation, and parents or caregivers have a right to opt a child out, but they have to affirmatively reach out to the school to do that. Critically, for youth in foster care under SB 89, there's no opt-out, and there's no requirement to get social worker or caregiver or parent signatures or permission. They're required to ensure that young people have access to this. So there's no sort of additional requirement to get that approval. I hope that answers, but if folks have other questions, please ask.
Great, thank you so much. So we'll take a few more questions as well. I think there were some questions about just what if someone's not a foster youth, a youth experiencing homelessness? So I'll just talk to that. As Rebekah mentioned, the California Healthy Youth Act does require school districts to provide that once in middle school and high school. And if that youth who's experienced homelessness maybe missed or was moving around and didn't get that, definitely reach out to your Planned Parenthood right here. Reach out to your local Planned Parenthood provider, because while this course was meant for foster youth to kind of meet that gap, there are local resources available to you. So go ahead and find that there. And JBay also does have a contact list on our website as well for how to find your local resources around sexual health education. So I think there were a number of questions too, just more about how to sign up. And there was a question from a young person, what if I don't have a phone number myself? So Zoe or Francesca, could you just talk about, again, to reinforce, like, if someone doesn't have a phone number, what's the best way to do that?
So if you don't have a phone number, it's perfectly fine. The phone number is for, at least for the youth, it's to more so remind you, like, hey, we have a series going on today. If you have an email, that'll work too. But if you have neither, we just will contact the caregiver or the person, who may have registered you, to just help us remind you that the session is going to take place on a given day.
Great, perfect. And then if you can stay on, Zoe, there's a few more like technical questions here. Some of the questions were just about, are there any plans for these sessions to be made available online, but maybe not live presentation where someone would do it self-paced at their own time?
Francesca.
I can handle that. Thanks. So right now, the project that we're working on and Team Talk YAS is specifically not asynchronous, so it's specifically live to enable us to engage with youth and for youth to be able to like engage with each other and with the material in a very specific way, and to be able to practice some of the skills that they're learning. So currently, Teen Talk Yaz is live, and I think that's as in terms of like where it's going from here, that's kind of I'd say in development, because this is part of a grant that is like an innovation grant. So it's we're testing things out and all of that, but don't think we can speak particularly to when or if that's going to happen.
Mm-hmm. I will say there's some folks asking about partnerships with translation or Spanish speaking, and there was a mention that that's a future goal for this. This is, something that's being provided free, online, live, multiple sessions. It was created to meet an emerging need, but there are partnerships available. Both school districts and case managers or social work agencies can connect young people with translation services. And so there may be ways for that young person to still receive assistance with that, but also for young people who need materials in Spanish, as Kehao and others, Lydia, have mentioned from Planned Parenthood or Health Connected, that there are other resources that are currently available in Spanish for both parents seeking that training and for young adults. So it might not be this platform, but another one. And that's why these contact information is so important. We can help meet the needs of all of our young people together by finding that right resource. So please reach out and we'll help connect you with what is currently available, and we'll work towards that future goal as well. So that does bring us to 5 minutes of Q&A. So I'm just double checking that there might be any final questions. Some were about sharing this. Can you share a flyer? Can you share this on your social media? How can you help spread the word? So I'll make sure in my email to pass that all on to you. And if you help us spread the word, we're going to make a difference for all those young people who are able to attend this course and get that education that they deserve and that they were intended to receive. So thank you so much. And I will close out for the day by thanking our presenters, thanking our attendees, and Kat, again, we look forward to seeing that new release of your podcast. And thank you so much for your sharing your personal experience today. Great. So we'll see you all next time. And thanks for joining us this morning.